Exposure to metal toxins can be reduced by understanding the source of the metal exposure and adopting strategies to reduce the contact with them. First, become familiar with the symptoms of toxicity and the first aid procedures for ingestion of substances that contain toxic metals. And finally, avoid mercury amalgam dental fillings to reduce the mercury exposure, especially when multiple fillings are needed. In one study, individuals who had 7 or more mercury fillings had 30 to 50% higher urinary mercury levels compared to individuals without any mercury fillings. Since studies have shown that exposure to mercury via dental amalgam fillings possesses health risks, removing and replacing the existing dental fillings with mercury-free composite materials should be considered. Several dietary constituents have been investigated for their ability to mitigate the metal toxicity. They work by reducing or inhibiting the metal absorption from the gut, binding up the toxic metals in the blood and the tissues, and helping to draw them out of the body, or reducing the free radical damage, which is a significant contributor to the pathology caused by heavy metals. Since many toxic metals mimic nutritionally essential metals, they compete for the same transport mechanisms for absorption from the intestine and uptake into the cells. Therefore, adequate intake of essential trace minerals can reduce the toxic metal uptake. For example, nutritional zinc or iron deficiency can increase calcium absorption, and lead absorption from the gut appears to be blocked by calcium, iron, and zinc. In animal models, selenium blocks the effects of lead when administered before exposure, and it reduces mercury toxicity. It also increases its excretion in humans. Most toxicity data supports the recommendation in non-pregnant adults to limit the consumption of high mercury fish to no more than 1 serving per week. The EPA recommends pregnant women, nursing mothers, and young children avoid eating high mercury fish because the fetal brain is more sensitive to the mercury toxicity than the adult brain. High-quality fish oil supplements represent a good alternative source of omega-3 fatty acids, EPA, and DHA. The International Fish Oil Standard Programme is an organisation that's dedicated to differentiating the high-quality fish oil products from the lesser quality. In order to ensure that your fish oil supplement doesn't contain dangerous concentrations of contaminants like heavy metals, check the label to ensure the supplement achieves the rigorous IFOS 5-star rating. In addition to its role as a possible competitive inhibitor of mercury and lead absorption, selenium also increases the toxic metal excretion. A moderate 100 micrograms a day increase in the dietary selenium increases the urinary excretion of the stored mercury in long-term mercury-exposed Chinese residents, and 100 to 200 micrograms per day reduce the blood and hair levels of arsenic in Chinese farmers with arsenic poisoning. Selenium also appears to mitigate the toxicity of some heavy metals like cadmium, thallium, inorganic mercury, and metal mercury by modulating their interaction with certain biomolecules. In another study, supplementation with 100 micrograms of selenium in the form of selenomethionine daily for 4 months led to a 34% reduction in the level of mercury detected in the body hair. The authors of the study concluded the mercury accumulation in the hair can be reduced by the dietary supplementation with small daily amounts of organic selenium. 3 studies have investigated the use of modified citrus pectin on the mobilization of metals from the body stores. In the first, 8 healthy individuals were given 15 grams of modified citrus pectin every day for 5 days, and then 20 grams of the modified citrus pectin on day 6. Significant increases in urinary excretion of arsenic, mercury, cadmium, and lead all occurred within day 1 to 6 of the modified citrus pectin treatment. There was a 150% increase in cadmium excretion, a 560% increase in lead excretion on day 6. Essential minerals like calcium, zinc, and magnesium were not noted to increase in the urinary analysis. Second, in a series of case reports, 5 patients with different illnesses took the modified citrospectin alone or in combination with alginate for up to 8 months. The patients showed a 74% average decrease in the toxic heavy metals after the treatment. In a third trial, 7 children with blood levels greater than 20 micrograms per deciliter received 15 grams per day of the modified citrospectin for 2 to 4 weeks, and the blood lead levels dropped an average of 161%, and the urinary lead excretion increased by an average of 132%. Data from preliminary human studies reveals naturally occurring dissolved silicone from mineral water appears to antagonize the metabolism of aluminium, potentially reducing Alzheimer's risk, and it supports cognitive function. In human subjects, soluble silicone decreases the aluminium absorption from the digestive tract, and it decreases its accumulation in the brain. In one study, Alzheimer's patients drank up to 1 litre of mineral water per day, containing up to 35 milligrams of silicone per litre, for 12 weeks. Over the study period, the urinary excretion of the aluminium increased without affecting the urinary excretion of the essential metals, iron and copper. In addition, there was a clinically relevant improvement in cognitive performance in at least 3 out of the 15 individuals. Another source of orthosilicic acid studied for their metal-reducing property are compounds called zeolites. Zeolites are aluminium silicon oxide-based crystalline compounds with adsorbent properties, and they have broad industrial applications, and they're finding applications in medicine. Inclusion of zeolite as the zeolite clinoptilite in high lead diets of lab mice reduced the tissue lead concentrations by 77 to 91% and increased the percentage of healthy red blood cells and reduced the chromosomal damage. A clinical study on 33 men evaluated the ability of zeolite clinoptilite to increase the heavy metal urinary excretion. To be included in the trial, the men had to test positive above a predetermined threshold for at least 4 of the 9 metals in the urinary test, i.e. aluminium, antimony, arsenic, bismuth, cadmium, lead, mercury, nickel and tin. The men were then given either 15 drops of clinoptilite water suspension or a placebo twice a day for a maximum of 30 days. Significant increases in urinary excretion of all 9 metals were observed in the men who were taking the clinoptilite when compared to the placebo, without a negative impact on electrolyte profiles. It's been hypothesized the biological activity of some of zeolite might be attributed to the orthosilicic acid. Vitamin C is a free radical scavenger, and it can protect against oxidative damage that's caused by lead, mercury and cadmium. It can prevent the absorption of lead as well as inhibit its cellular uptake and decrease its cellular toxicity. Observational data suggests an inverse relationship between serum levels of ascorbic acid and blood levels of lead. In other words, the higher the blood levels of vitamin C, the lower the levels of lead. Vitamin C supplementation at 500 milligrams per day in 12 silver refiners with high blood lead levels demonstrated a 34% reduction in the lead level after 1 month. In a small study of 75 smokers, vitamin C at 1000 milligrams per day reduced the blood lead levels by 81% after 1 week of supplementation. Lower dose of vitamin C at 200 milligrams per day had no effect. Through its antioxidant action, vitamin E mitigates some of the toxic damage that's caused by heavy metals, which are strong inducers of oxidative stress in the tissue. In one study, rats were fed a diet containing lead acetate, and they subsequently developed signs of toxicity, such as oxidative damage to the lipids and alterations in blood chemistry parameters. When either vitamin E or garlic oil were administered in conjunction with the lead, the toxic effects were ameliorated. The researchers who conducted the study noted the protective effect of the vitamin E was probably due to its ability to support the detoxification and to scavenge the tissue-damaging free radicals. In animal studies, one group of mice were given toxic metals like lead, mercury, cadmium and copper in their drinking water for 7 weeks, while another group underwent the same treatment, but in addition received vitamin E 5 times per week. The scientists found the mice who were not receiving the vitamin E exhibited evidence of oxidative injury in their kidneys and testes, whereas those organs appeared normal in the mice who had the vitamin E. Also, the mice not receiving the vitamin E showed changes in the plasma levels of creatinine, urea, and uric acid, while these blood parameters didn't change significantly in the vitamin E group. Vitamin E has also been shown to counter the deleterious effects of heavy metals in humans. In several groups of workers regularly exposed to airborne heavy metal toxicity due to the nature of their work, the daily supplementation with 800 mg of vitamin E and 500 mg of vitamin C for 6 months led to improved markers of intrinsic antioxidant defenses and decreased markers of oxidative damage. In fact, following the period of supplementation, the activity of certain intrinsic antioxidant systems reached levels comparable to those observed in control subjects not exposed to toxicants. Folic acid is a cofactor in sulfur-containing amino acid metabolism, and sulfur-containing amino acids, cysteine and methionine, are precursors to known heavy metal chelators alpha-lipoic acid and glutathione. In a study of 1,105 pregnant women, 841 of which were followed through late pregnancy or delivery, higher blood folate levels were associated with lower blood mercury levels during mid and late pregnancy. A similar study in Australia on 173 pregnant non-smokers demonstrated that the failure to use folic acid or iron supplementation during pregnancy was associated with higher blood cadmium levels. Garlic contains many active sulfur compounds which are derived from cysteine with potential metal chelating properties. These garlic constituents might also protect from metal-catalyzed oxidative damage. Rats who are fed garlic as 7% of their diet, either a week before, after, or during exposure to heavy metal toxins, for 6 weeks demonstrated significantly reduced lead, cadmium, or mercury accumulation in their livers. Garlic treatment also reduced the frequency of metal-related lesions in the liver of rats. And garlic can also increase the bioaccessibility of iron and zinc, both antagonists of cadmium and lead absorption. CILANTRO, or Coriandrum sativum, can bind and immobilize mercury and metal mercury from contaminated water. In mouse models, the cilantro suspension significantly reduced the deposition of lead into the bones, and it reduced microscopic signs of lead-induced kidney and testicular damage. In a case report, a patient who was exposed to mercury during amalgam-based dental filling removal developed adverse effects, including abnormal ECG readings, and these were reverted almost back to normal by administering 400 mg per day of cilantro extract prior to and after the removal for 2 to 3 weeks. The mercury deposits were reported to be absent following the treatment, although the details of the treatment and the mercury analysis in the report are unclear. Sulfur-containing amino acid compounds can complex with heavy metals, and the sulfur antioxidant alpha-lipoic acid and glutathione have been demonstrated to chelate a number of metals in cell culture. In a rat model, alpha-lipoic acid and glutathione reduce some of the adverse changes in blood parameters, including drops in red blood cell numbers and size, as well as reductions in hemoglobin concentration brought about by intoxication with lead, cadmium, or copper. Alpha-lipoic acid and glutathione in a rat model both reduced the cadmium-associated oxidative stress and improved the activity of the antioxidant enzyme catalase in the kidney tissue. N-Acetyl cysteine provides a source of sulfur for glutathione production, and it's effective at reducing oxidative stress due to heavy metal toxicity. As a sulfur-containing amino acid, it possesses 2 potential binding sites for metal, and is capable of binding and sequestering divalent copper, trivalent iron, lead, mercury, and cadmium ions. Chronic exposure to toxic metals can decrease cysteine levels. In animal models and cell culture experiments, N-Acetyl enhanced the renal excretion of lead. It lowered concentrations of mercury, and it protected against cadmium-induced liver cell damage. Cysteine might also be useful as part of a complete protein, such as whey protein, which provides additional essential amino acids that might block the entry of metals into the nervous tissue. Glycine is a conditionally essential amino acid and is found in plant and animal proteins. Chemically, glycine is the simplest of all amino acids. It combines with many toxic substances and it converts them to less harmful forms, which are then excreted from the body. Glycine is also involved in the body's natural synthesis of glutathione, which itself is an important detoxifier of heavy metals. In a study of strongylominophagon C, a Japanese drug that contains glycine, glycyrrhizin, and cysteine, and is said to be protective against chronic cadmium toxicity, the authors concluded the reported beneficial effects were due to the glycine. The glycine appeared to reduce the oxidative stress of chronic cadmium toxicity. Among the myriad of functions, certain strains of probiotic bacteria can minimize toxin exposure by trapping and metabolizing xenobiotics or heavy metals. The probiotic bacterium strain Lactobacillus rhamnosus, Lactobacillus plantarum, and Bifidobacterium breve were all shown to bind to both cadmium and lead in lab studies. Binding was observed for both live and heat-killed cultures of the LC705. However, the efficacy of heavy metal binding by probiotics might decrease when multiple strains are combined. In mouse models, two different Lactobacillus plantarum strains reduced the tissue accumulation of cadmium and lead and protected against oxidative stress. CHLORELLA is a unicellular green algae, and it has the ability to bind cadmium, zinc, copper, and lead. It's been used to detoxify wastewater of metal contaminants. In preclinical studies, CHLORELLA lowered the bioavailability and it accelerated the excretion of metal mercury as well as cadmium, and it reduced lead-induced bone marrow toxicity. For more on herbs, supplements, and natural treatment plans, check out my website.